We're now going to look at the mechanical interventions that can be used to help to decrease increased work of breathing. Fan therapy is using a fan in front of the face and it has been shown to help to decrease dyspnea. This can be a simple handheld fan as in the pictures. However, some patients will use the larger floor fans that you'll have seen in the summer. The reason for this could be that the stimulation of the trigeminal nerve by the air from the fan fools the receptors in the brain into believing that the respiratory flow is higher than it really is. This means the sensation of dyspnea is decreased. The evidence to support fan therapy is lacking. However, in practice, you may find that many patients will use it. You may find it harder in the acute setting to have access to a fan. However, it's something that you can discuss with your chronic patients. We're not going to discuss with your chronic patients. We're not going to spend too long looking at NIV. We're going to come back to this when we cover the intensive care unit. NIV stands for non-invasive ventilation and it refers to the provision of ventilatory support to the patient's upper airways using a mask or similar device. Indications are type 2 respiratory failure, an acidotic exacerbation of COPD, increased work of breathing caused by ventilatory failure, neuromuscular disorders, severe hypocapnia or fatigue, and it can also be used to wean from a ventilator. NIV provides a rest for the inspiratory muscles. It works by delivering a predetermined pressure or volume in response to the patient's inspiratory effort. This causes air to be forced into the lungs, and this lessens the respiratory effort and therefore reduces the work of breathing. In the acute setting, it unloads the respiratory breathing. In the acute setting, it unloads the respiratory muscles, decreases shortness of breath, improves oxygenation and ventilation, can help prevent intubation, and ultimately decreases mortality. It can also be used for our patients with chronic conditions. It has been shown to increase exercise tolerance in patients with COPD, decrease work of breathing for those with pulmonary fibrosis, and it can increase quality of life for those with cystic fibrosis. The evidence for NIV is strong. It should also be noted that physios can lead NIV services. Who is in charge of the NIV will vary from hospital to hospital and trust to trust. In some hospitals, the physios will be in charge of the NIV machines, and there will be a lot of training provided if you were part of the team that was providing it. However, it is usually a nurse-led service. We have covered a number of